The world is sinking, but Africa is rising. It's time for Africa to turn the tide of political conflict, economic uncertainty, and moral decadence. The time is now for Africa to arise and rebuild. Inspire E-Conference 2023 will give you the tools and strategies to be part of Africa's rebuild. Join us online this August from Monday the 7th to Saturday the 12th from 7 p.m. to 9:30 p.m. East African Time as we gather the brightest minds across the continent to discuss the rebuilding of Africa. Book your slot today and be part of the movement that will change Africa forever. Africa, arise and build.
We're going to be joined in by one of our speakers, and I'm just going to introduce her shortly, and we'll be able to listen from her. Just like I mentioned, we are going to look at the appropriate spiritual, mental, and physical wellness that is required to build Africa. And joining with us this evening is a very accomplished pediatrician and public health specialist with more than 28 years of professional experience. She has dedicated over half of her career to address public health issues among children and their families. Her background includes working at Mulago Referral Hospital for over 15 years, and followed by roles in other institutions like Center for Disease Control and Prevention, UNICEF in Zimbabwe, USAID in Zambia. And for the last 2 years till September 2022, she did serve as a UNICEF Regional Early Childhood and Development Consultant, providing technical assistance to UNICEF country offices. And that's especially in nurturing care for young children aged 0 to 3 years in the region. She's born again and she loves the Lord. She's married to Dr. Damon Kitabire and a proud mother of 3 grown daughters. She's currently working as an independent pediatrics and public health consultant, focusing on child health and their families. She's dedicated to learning more about being a servant and an ambassador of the Lord, wherever her life's journey takes her. And join with me this evening to welcome Dr. Florence Naluyinda Kitabire to speak to us. Welcome, Dr. Florence, and over to you.
Good evening, good afternoon, where we may be, all of us. It's such a delight. Very inspiring speaker. Thank you, Doctor, giving us the spiritual aspect of our arising and shining in Africa. And that has given us a great background from which now to talk about the appropriate physical, mental, psychical wellness required to build Africa. As you said, there were several of us, so I'm going to major on the physical wellness. However, as we've slide is not moving.
Okay, would you prefer somebody moves the slides for you?
I've
okay.
done it. So,
all right.
So these are some of the things that we are going to ponder over as directed. What does spiritual health really mean for the average African? And if we are to provide direction and leadership in transforming Africa, what would our goals for health look like? Also, there's a practice and tendency in our continent, I don't know whether it's only us, but the delay on seeking the preventive approach of our health. So wait until the ailment sets in, and that's when we seek medical advice. So how do we go about that? And then this very important question, when we look at our healthcare system and its governance structures, manpower, technology, advancement, what would be our view on the readiness as Africa to improve the status of the physical health of our population? And finally, what would our priority areas be? So these are like the things I'm going to major on. as we go through this. However, I just wanted to talk about the overview of health. I know it's the obvious, but back to the basics. What is health? And I know I was given the physical aspect, but we all know that health is a state of a complete physical, mental, social, and spiritual well-being, and not merely the absence of disease and infirmity. And our previous speakers ably really dwelt on the spiritual well-being, which is really the foundation of all these other aspects of health coming in. So I really wanted to have this background. And it's a WHO definition declared in 1948, but since then it has not been amended. That's how comprehensive it is. Many aspects come, but the gist of the matter is still that state of complete physical, mental, social, and spiritual well-being. Frequently, the word health is used to describe the human well-being. So good health versus you are healthy, you are well. And our word says, thou shalt prosper even as your soul prospers. It is well with my soul. I mean, reminding us of how even health is a divine gift from God. Health does not just mean the physical well-being, though I'll focus on that today, but it has that whole engulfing of the individual and the whole community. I just wanted to refer to this great physician who was credited, Hippocrates, credited for encouraging the focus on the other aspects of health, the environmental sanitation, personal hygiene, in particular, like the balanced diets. He has the quotes like, let food be thy medicine and let thy medicine be food, which are still critical aspects of health today. He also is credited for starting the use of observation as a basis for acquiring health knowledge, of which we are practicing today. And that's how our Hippocrates ought to first do no harm, and the rest continues. So physical health, good physical health is very important, state of well-being when all our body, internal and external parts, organs, tissues up to cells can function properly as they're supposed to. And therefore, it's a state where an individual is physically fit to perform their daily activities with no restrictions. I can hear normally, I can see normally, I can walk, jump, run, etc., and perform many other normal activities without problems, seen and unseen, because a lot of things are internal, the liver, the spleen, the kidneys, the heart, the brain, all working properly. Of course, I know that the little bit of the mental health that goes with the physical health that is going to be dwelt on by many of my colleagues later, but it goes well with physical health, to have a sound mind. And then, of course, the social cultural health is how we interact with people in the areas around us. This also affects our physical health. So when we can make friends easily, work with people happily, friendly together in a group, this affects our physical health too. So as I said, back to our basics, principles of health. We know we are all created in God's image, as well explained earlier on. And he saw that everything he created was good. Cell, tissue, organ, system, the whole human being. Placed us in a family, placed us in a community. So as basic science dictates, the cell needs oxygen, water, food, and removal of waste products. And that's how we have to be healthy when all these are happening right from our cell level. Then the dis-ease is when the body is not at ease, which means the health principle is broken, and that's when disease comes in, dis-ease. So we all know the basic needs of our body right from our primary, kindergarten, but we don't know how commonly we take this. Most of this sometimes is taken for granted. But pure air, we thank God for this. Oxygen being the main component. Here we want to say early morning air, very fresh, countryside, very fresh, not polluted. How are we dealing with it in Africa? The sunshine that God gave us in Africa, the morning sunshine being the best, but sunshine has done a lot to maintain our health. How are we embracing it? Rest, including relaxing, sleeping, but furthermore, the Sabbath rest that the Lord gave us in his kingdom life. I remember when I was younger, we observed the Sabbath rest more than now. I don't know what has happened to all the advancement and technology. We have swallowed up our Sundays, but I remember growing up, Sunday was more of tools down and resting and contemplating and going to church and singing all our hymns and having fun before the week. Exercise, this takes different forms as we know, but let's remember to remain active. Proper diet, use of safe water, and the trust in a divine power of God. This is very important because many trust in other things, and that comprises their spirituality. But as Dr. has explained in detail, we are the salt and light to bring to Africa the trust in the divine power of our God. And last but not least, the self-control. This is being moderate in everything that we do. So with this, therefore, they are the key determinants of health, as we also may know that the health of individuals and communities is determined by the environment and circumstances in which we live and operate, the socio-economic, the physical environment, our characteristics and behaviors. But there is a relationship between us and our environment, and it critically determines our health. That's why it's determinants of health. They make us become healthy or not. And these include several things summarized here. The state of our environment is key. These days, there's a lot of environment coming to the front in many aspects of our lives. Even in our organization, there's always what are we doing with the environment campaign? Everything is going there, climate change, all this, the state of our environment, the standard of our shelter, access to safe water and sanitation, and other basic needs. Access to essential food, physical activity, as already said, and the rest. Level of knowledge on what affects one's health is very key. And not forgetting the level of household income and economic well-being. However much I want to be in physical good health, if this is constrained, then I can't achieve the physical health. So all the above significantly impact on the health status of both individuals and our communities. So what are the general challenges then? How do determinants of health affect us? In Africa, we know that poverty is still a significant challenge. A big percentage of our population is living below the poverty line, consuming, household consuming below $1.9 a day. And it's estimated at 34%. That means a third of our population. Though it may have decreased from the earlier years, but it's still a significant factor. And we all know that it can be as high as 50% in rural areas and even among the urban poor or peri-urban poor. And this brings income inequity among the population, which has remained high and impacts on our health a lot. This has clear health implications from nutrition indicators, where the poorest quintile is twice as hard hit, malnutrition, high, and later on it even affects our health-seeking behaviors, we shall see. With all the wealth of food and we have in Africa, as the previous speakers of the last 2 days were implicating, we have a rich continent endowed with food and different kind of great things, but we still have protein energy malnutrition as a major public health problem. What are we doing as children of God? To me, this is always something I say it should not be. And yet when I see it contributing to almost half of all the under 5 deaths, I'm like, I need that Joseph trigger that I had on Monday, even yesterday. A big portion of our children are still stunted, underweight, or wasted. And the solutions have to come from us, not outside the continent. Furthermore, we had this very good practice of breastfeeding, but with the involvement of the mothers going into the workforce and embracing different kind of practices, only 40% of our children, less than 6 months, are exclusively breastfed. And some only breastfeed for 2 months, especially the working mothers. Then we have this inadequate access to safe water on the continent. The population without access is estimated to be over 400 million people, lacking even the basic level of drinking water, and more, twice as much, lacking basic sanitation. 2020 report shows that 64% of the sub-Saharan Africa had only access to these basic drinking services, compared to over 90 of the population from the other 6 regions. I'm like, no, this, I think, as someone said, the passion for Africa should stir us to change this status quo. And yet we are endowed with a big percentage of the world's freshwater resources. All our rivers as listed there, Lake Victoria alone, given Uganda, the equatorial climate that gives us rain all year round. We should be improvising to have safe water for our people. Limited access to safe sanitation. Unfortunately, still a significant number of our populace has no access to toilet facilities and still practices open defecation, ugly as it may sound, in the fields, forests, bushes, bodies of water. And if we had to discuss what is happening even in our city, we would close our eyes with some shyness, but this is happening, putting it in all the drainage. And recently, even people just standing next to a tree and pass urine. This should not be. And as we said, this is how we are light to this world. Disposing of the garbage by dumping is widespread. It's a topic that can take the whole evening to discuss. Poor environmental sanitation, we know, therefore, is a major source of public health problems and epidemics in Africa. The cholera epidemics, we know them, and different other kinds. So we just have to know that it's a major aspect that we need to address. Currently, over 80% of the health conditions presented in our health institutions in several countries are communicable diseases related to this poor environmental sanitation, which has significant adverse impact on the poor. Of course, I have to say especially children as my passion and their families. However, I just wanted to also comment that most of the health institutions address mainly maternal and child health, maternal, newborn, and child health conditions. So this is the gist of the population challenge. Then we have the low education and literacy, ladies and gentlemen. That is among the major determinants of health and development. We know very well it equips our people massively with knowledge and skills for self-problem solving, ability to access and understand information on health that we've been talking about the previous slides, and helps provide a sense of control over their life circumstances. And yet we are still low in education. Education, on the other hand, also increases what we know, job and income security, and ultimately household wealth status, all of which have direct impact on our physical health and well-being as individuals. However, the low education lingering on the continent is linked to poor health, more stress, low income, and sometimes low self-confidence. These are the things that we need to look onto to rebuild as Africa. And we know that urban areas, on the contrary, may have, on average, may have higher literacy than rural areas, although that has to be evaluated further. Then we have our social culture aspects. Every community has, but over the continent, we know that culture affects everything people think or do, from what they eat, how they eat it, how they prepare their food, even how they are allowed to be healed. So culture shapes people's health as much as their genes do. The way we define ourselves culturally, our beliefs, our disability, our age, all perceive the source of ill health and health-seeking behaviors. That's why we're like, some people can easily say, why go to look for what I don't have? It will come and I'll see it. Partly it's culture. However, we know that prevention can be better than cure. So even if efforts can be made to promote good health, let's remember and strategize how to address the practices, some of course gender-related, that can negatively affect our health. The one that could come out easily are the early marriages, still practiced in many of our communities, but we know what that does to the home and to the girl herself. Okay, occupational health, I wanted to bring this one out because most of us, like all of us here, are employed somewhere. But the occupational injuries and health hazards related have profound effect on our health, physical health and productivity, and our families too. And we know that there may be legislation regarding this, but a lot remains to be reinforced. We know the mining community in some of our countries have had hazards like the cancer and silicosis, for example, pesticides in agriculture, not to mention the industrial waste from the industries, all need attention at policy and strategic level, and especially implementing the safety guidelines that exist. And then the silent killer, the excess stress that comes with some of our jobs until people get high blood pressure and diabetes and the like. All these are to be addressed. So all the above have very important aspects on the health status of our population, especially the physical health, making it necessary for health planning. So we need to be planned broader than just our health services. However, something to bring to the fore and ask ourselves, how much are we doing? The health education and promotion is a critical factor in improving the health status of the population. But even if you looked into our budgets, you may wonder how much we prioritize this aspect versus the curative and the other aspects of our health. A significant proportion of diseases we have seen facing the population and eventually the health system could be prevented just through health promotion. It's a challenge to say that I may have observed more health promotion growing up than now, but that's not to blame anyone, but to wake us up and say, what can I do? What can we do to make sure that health promotion is put to the front? And we know that it helps us control our own health, to make sure that even a 4-year a primary child kid can understand how do we protect our health and quality of life by adequate nutrition, adequate sleep, regular exercise, all these things we've talked about, and good sanitation. And this cannot then be seconded by primary health prevention, where we have our high impact interventions. And here we have done well across the life course, right from the womb to almost death. We've had vaccinations from tetanus, toxoid for the pregnant mothers, to HPV, all vaccinations which have markedly reduced our childhood mortality and morbidity on the continent, breastfeeding and growth monitoring, though we can do better. We need to make sure that we abstain from risky behaviors, especially adolescents and adults, where there is reduced physical activity and substance abuse, but also focusing on reinforcing the safe practices. I think here we fall short. The seat belts, the bike helmets, I know they all come with health education, but we need to do it. So health is wealth, and we should preserve it, for we shall prosper even as our soul prospers. Secondary prevention, I won't go much in it. It's in the screening of both cancers and non-communicable diseases. Then the tertiary, which is expensive, but where we dwell most, is reducing the impact of an ongoing illness or injury. It's mainly the rehabilitation. Then I wanted to comment on geriatrics. That is the management of the old citizens of the continent. It's still a challenge too, mainly because maybe the life expectancy was lower earlier on, but as it is increasing, this is an area to have a special focus on. Then another related question was, what is Africa's readiness to improve the status of this physical health? And this comes more to the health systems. How are we dealing with our health systems? We need health systems that can deliver services equitably and efficiently to achieve improved health status. This, we know what a health system consists of, just won't go to the detail, but we know we need staff, we need funds, information, supplies, transport, communication, and the overall guidance and direction for it to function. And Africa has a challenge of weak health systems, and health strengthening, therefore, is a priority. And that's how the WHO comes in with the 6 health system building blocks that we need to focus on. Health service delivery, I've built on it, I don't have to go further detail, but we have this health workforce too. The availability of the adequate numbers of qualified and experienced health workers with the right skill mix is a major determinant of health service performance. However, Africa, we have these 2 main problems regarding our human resource for health: the critical shortages of health workers, leading to abnormal staff to patient ratios, lines of 100 people waiting for one healthcare worker. Then their inadequate distribution of those few that are available leads to great imbalances, which we need to tackle. Then the health information system, we need it because it's the one that guides our planning, monitoring, and evaluation. We need the supplies, ladies and gentlemen. How many times have we been in hospitals and there are no medicines and our population suffers? We need access to essential medicines and medical supplies. And this is a critical factor in ensuring efficient and effective delivery of health services to meet our national health priorities. Then the big thing of health financing. This, you may have heard it in different circles, but we have a challenge of health financing. Our main source of health care is government budget appropriations, which we know they struggle. We have some donor funding, but they are earmarked. Some are earmarked to the National Treasury, but others is donor support to just specific projects and activities. And then there's this household expenditure that varies. Many people have to pay out of pocket, but some of them can't come to the hospitals because they don't have the finances. So what do we do with these finances? We need to really, this is an area where we all have also to be very innovative to see, because the current resource envelope is far below the minimum required for the delivery of an optimum package of care that we are talking about. You may have heard of the Abuja Declaration of 15% of the national budgets to be allocated to health. I'm yet to see a country that has had 2-3 years with this 15%. Sometimes we reach 8, then we come back to 5, and come back to 4, and high-level advocacy and understanding needs to be done at this level. As I said, external support is targeted, and sometimes there's rigidity, and therefore these funds cannot be used for other priorities, especially the areas that are less favored by donors. But that goes back to, let us be our own donors. I believe we can do it when we open up the kingdom mindset. Then private health insurance is also available, but for now in Africa is mainly by employer-based or some voluntary medical schemes, but it needs to be universal, it needs to be national so that equity can prevail. Last but not least is the leadership and governance. We also have it in this sphere of health. And these are very critical factors to leaders. Leadership, it means stewardship of these health sector resources, and of course, governance are the systems and structures. The performance of the health sector in the area of leadership and governance has to deal with public policy, legislation and regulation, management, in our case, including decentralization of health and its effects, and also planning and resource mobilization. Therefore, strengthening health system means addressing the key constraints in each of these areas. Many global health initiatives you may have heard of, now they incorporate the attention of health system strengthening in the support they provide to countries. Let's also embrace it and see how we can be part of this and partner and make sure that we improve equity of our health systems, because robust health systems are critically needed towards providing universal health coverage in Africa, and with the overall goal of improved health. Therefore, what should our priority area be? A nation of healthy and productive people. Thank you.
The world is sinking, but Africa is rising. It's time for Africa to turn the tide of political conflict, economic uncertainty, and moral decadence. The time is now for Africa to arise and rebuild. Inspire E-Conference 2023 will give you the tools and strategies to be part of Africa's rebuild. Join us online this August from Monday the 7th to Saturday the 12th from 7 p.m. to 9:30 p.m. East African Time, as we gather the brightest minds across the continent to discuss the rebuilding of Africa. Book your slot today and be part of the movement that will change Africa forever. Africa, arise and build.